Hi guys, it's Don. It's January 6, 2011, one day after the Republicans took control of the House of Representatives and gained seats in the Senate. And I was hopeful at this week's blog I was going to be able to discuss some positive news from the Bureau of Labor Statistics, talking about the increase in healthcare hiring. In 2010, 720,000 jobs were created last year, while other sectors lost about 8.5 million. And I want to talk about the positive outlook for 2011 in healthcare hiring. But I think something that's taken over the past couple of days really paints a gloomy picture for the future of that. As I said earlier, it's a day after the Republicans took control, and later today there's going to be a vote on the repeal of health care reform, or as they call it, H.R. 2, the repealing of the Job-Killing Healthcare Law Act, that will take place later today. I know that there's not much of a hope of repealing it with a Democrat-controlled Senate and a Democratic president who will probably veto it, but I think it will pass the House. I'm just very concerned with the way this is shaping up. I understand we have two parties in this country. I've talked about it in past blogs, but everybody keeps talking on the Republican side about how the American people want this act to be repealed. And there's some new numbers out from the Congressional Budget Office that says repealing it would cause an increase in the deficit of about $230 billion by the year 2021. Republicans say those numbers can be skewed any way you want. But regardless, nobody's talking still about what we would replace it with. Michael Steele, who is Speaker of the House Boehner's spokesperson, said yesterday, as a matter of fact, in a statement, that the American people want this to be repealed. We're going to repeal it and replace it with common sense reform. No one will say what those reforms are. When are we going to be able to have a conversation to actually talk about what the reforms should be? If everybody's complaining they don't want a mandate to have to buy insurance, they don't want this part, they don't want that part, but nobody's getting together on both sides and saying, okay, then what do we do? I mean, what is the answer? When are we going to sit down and have that conversation? Or are we? Because right now, it's one day into the new Congress, and I'm not sure we're going to get anything done in the year 2011. And that's very sad. If I'm all about, free speech and the American values, but we have to have a common sense discussion about it instead of just making sure that one side or the other side wins. Because then the American people don't win. The patients don't win. The doctors don't win. The providers don't win. And that just doesn't seem to make sense to me. Just to be able to say that you repealed it because the Tea Party wanted it repealed. Well, fantastic. But what are you going to do when healthcare costs are just through the roof and we have these millions of baby boomers who are going to need healthcare here in a few years? It comes down to the individual patient. It comes down to the individual. And nobody's caring about the individual. They're just caring about their side coming out on top. I just really want to know when we can have an open and honest discussion. And I hope it comes soon. I'll be interested to watch what happens over the next couple of days and next few months with the repeal or non-repeal or of healthcare reform. But someday somebody's going to wake up and realize that you need to actually sit down and talk to the people who are affected by this. Because as far as I'm concerned, the senators, the congressmen have a pretty fantastic healthcare plan. And they don't really have to worry about it on a day-to-day basis because all of their costs are covered. But I know mine aren't, and I know many other people, family members, friends, co-workers whose aren't either. And we're fighting with insurance companies right now to get our basic coverages paid. So I'd like to have an open, honest discussion. I'd like to be part of that discussion, and I hope I'm allowed to in the future. But first, we have to actually sit down and have somebody open to listening to our ideas. So if that's a possibility, I welcome it. I welcome maybe an open and frank discussion with some of our elected officials who are supposed to be looking out for us. All right, hopefully next week I get to talk about some positive numbers. We'll see what happens over the next week. But I'm also looking forward to introducing you to one of our new recruiters, Doreen Delancey, next week. So have a great week. Keep an eye out on the news. And again, always open to comments and suggestions. Thanks, and hope to hear from you soon. Take care.